Good morning, everybody. Once again, your friend Dr. Salim is here. Just one thing, it just came to my mind if I could share with you guys, which is sometimes we don't know about our cardiovascular diseases, specifically if it's a plaque buildup. When the plaque reach to 69% in a vessel and an artery, then it produce sign symptoms and the patient feeling sign symptoms. So for all those healthcare providers, if you have anybody at home who are more than 50 years old or 60 years old or 65 years old, don't forget if you could just check their carotid arteries and make sure that the brain get enough blood. So specifically, I will suggest look for both for the CCA, common carotid artery, look to the bulbous area, and also if we could check about the ICA, which is internal carotid artery, which actually give blood to the brain. You guys all understand that part. So I think this is more important. We should not wait for the sign symptoms. We should not look for because that will be too late. If we get the sign symptoms and then we check and there is a plaque buildup, which is more than 50%, but almost close to the 70%. And then if 70% or 69% of the vessel, specifically the artery, when it's closed, I think that's a really bad idea. It's dangerous. It's really dangerous. So we understand if you have, or anybody at the house, if they're age like 65 or more than 50 years old, if they have any sign symptoms, if they have any chronic diseases like diabetes, like hypertension, hyperlipidemia, or stress, depression, all those things, if they have a disease or they don't have a chronic disease, better to check their carotid arteries. It just came to my mind, why not to share, because it's our specialty. It's better to share with all the friends. So it's just as an advice, as a doctor, it's better if we could check all those patients. If it's a patient, if it's a family member, at least, don't wait for the sign symptom to come in and then we just take the patient to the doctor. So if you are a doctor and you scan the patient and you do carotid artery studies or upper extremities, lower extremities, if you scanning the Doppler studies, vascular Doppler, better to start from your own family and look if anybody's, unfortunately, or I hope not, nobody's suffering from that, but it's better to know ahead of time before it reach to a point, this plaque buildup reach to a point where they can produce a lot of sign symptoms, and then it will be too late. So I think it's my advice, try your best and check it. Do it just for the evaluation, do screening for them, and then good to know ahead of time. Thanks a lot and have a nice day.